Many Americans who want to get the newest COVID vaccines may now have a harder time doing so after the Food and Drug Administration limited approval for the shots to adults 65 and older or those who are at high risk for severe disease. The vaccine was previously available to anyone 6 months and older. People have questions, and we're going to try to answer some of them now with Caitlin Jetelina. She's adjunct professor at the Yale School of Public Health and the author of the Substack column, Your Local Epidemiologist. Welcome back to the NewsHour. Thanks for joining us.
Thanks for having me.
Let's just start with the basics here. Right now, according to the FDA, who is eligible to get the COVID-19 vaccine?
That's right. So FDA narrowed its label last week for COVID-19 vaccine to only people that are 65 and older and those 6 months through 64 years with at least one high-risk condition. This is a big departure from past years, and it is quite unusual for the FDA to restrict a vaccine this way. Meanwhile, medical groups don't necessarily agree with the FDA label. Pediatricians, for example, recommend all kids under 2 get vaccinated, whether they have a high-risk condition or not. Plus, high-risk kids and those living with vulnerable family members. And so as you can imagine, this is starting to get confusing pretty quickly because you can end up with scenarios where on one hand, pediatricians say a healthy 1-year-old should get a COVID vaccine this fall because of their little vulnerable immune systems. But on the other hand, FDA label says no. And so that means for some families, they could be pushed onto getting off-label COVID-19 vaccines this fall.
Just one more definitional question here. When you're talking about high risk, what are we talking about? What does that include?
Yeah, so FDA didn't spell this out last week, but they did defer to CDC's list. And this is good news because it's very broad. High risk includes everything from pregnancy to those with diabetes or obesity and cancer, disabilities, or even mental health conditions. And so by some estimates, that covers nearly 3/4 of U.S. adults.
And as folks are trying to understand this change, you mentioned it's not typical for these kinds of policy changes to happen. There's disagreement in the medical community. What is your understanding of what led to the change? Did something change with the vaccines or COVID itself?
Yeah, so science hasn't changed, right? The vaccine is still effective at providing additional protection, and it's also safer than the virus itself. What has changed is one, the environment, right? Most of us now have some level of immunity, and our ICUs aren't overflowing. We're not in the middle of an emergency, which is great. And so on one hand, it does make sense to prioritize pregnancy in kids under 2 and older adults, for example. But the way this policy is being rolled out, it's out of order, it's inconsistent, it's very unclear, it's not transparent, has left a lot of pharmacies and physicians and families scrambling, mainly because RFK, our Health and Human Services Secretary, doesn't believe that this process was evidence-based, although it's been the process we've used for the past 90 years.
So you mentioned the pharmacy piece of it there. People have probably seen both CVS and Walgreens are now limiting access to the COVID vaccine in some states, requiring prescriptions in others. If people want to get the shot, are they going to be able to get it through their local pharmacy, and is insurance going to cover it?
Yeah, this is like the billion-dollar question, right? And this is critical because 90% of COVID vaccines are given at pharmacies. So right now, 2 things are happening. One is in about 16 states, pharmacies like CVS or Walgreens have paused COVID-19 vaccines altogether because their state's authority depends on very clear guidance, which we haven't really gotten from CDC. We are supposed to get it in June. They still hasn't come out yet. So those states are in limbo. The second thing that's happening is that in other states, pharmacies may still offer the vaccine. They may still have them in stock, but for people who only fit the FDA label, pharmacists generally cannot give vaccines off label. So if you're a healthy 40-year-old who wants to get the shot, you'll probably be turned away from your pharmacy. Insurance coverage is also in limbo. It's not entirely clear whether health insurance is going to cover the cost of your vaccine. And this uncertainty makes it very difficult for families who want to protect themselves.
So a lot of questions we don't yet have the answers to, it seems like. But, as you mentioned, pretty much anyone 6 months and over could get the shot before this policy change. But we should also point out uptick of the vaccine has been very low among adults. CDC data showed that less than a quarter of adults received the shot last year. So for most people, if you had the original shots, if you got some boosters, if you've had COVID, should they still be getting the COVID vaccine?
What we're seeing is that the data is consistent, that if you get a COVID-19 vaccine, you have additional protection against COVID infection, albeit not perfect, but also severe disease for at least 4 to 6 months after the vaccine. It is getting really confusing. For my family, I'm going to still follow the evidence-based guidance for medical societies. I am young, but I also have a chronic condition, so I will still be getting this vaccine this fall. Also, the vaccines aren't the only tool we have in our tool belt. I'm sure people are really sick of the Swiss cheese model, but there's also other steps to take not to get sick, like wearing a mask in crowded indoor spaces, testing before you visit grandparents in the nursing home. There's many ways to balance risk at this moment.
If I ask you to take a kind of step back and look at the bigger picture right now, we saw last week Health and Human Services Secretary Robert F. Kennedy Jr. fire the CDC director, Dr. Susan Minares. That also then led to the resignation of multiple other senior CDC officials who all said they were concerned about his leadership, concerned about his stance on vaccines. I just want to get your response to that as someone who tracks this very closely. What are your concerns, and are you worried about the CDC losing its credibility in this moment?
Last week was a huge week in public health because essentially CDC imploded, right? Like you said, the director and 4 senior leaders were pushed out. And these aren't not just bureaucrats. There was very steady hands who guided us through crises after crises with clarity, compassion, and were evidence informed. And when leaders like this are forced out, it is not just the agency that suffers, it is all of us, right? A weaker CDC means communities are more vulnerable, from outbreaks to chronic diseases to even basic health data. The foundation of public health is eroding faster than I ever thought possible. And I don't say this lightly, but if we do not change the ship's direction, I truly think our nation's health security is at risk.
Caitlin Jetelina, author of the Substack column, your local epidemiologist. Always good to speak with you. Thank you.
Thanks for having me.